Hello, I'm Dr. Carol Langford, the Director of the Center for Vasculitis Care and Research here at the Cleveland Clinic. And I'm delighted to be joined today by Ms. Lynn Corwin. I've had the privilege of caring for Ms. Corwin and working with her in Churg Strauss syndrome since 2009. And we're both very pleased to be here with you today to share with you a little bit about Churg Strauss syndrome, about vasculitis, and to get Ms. Corwin's perspective on what this illness has meant to her during the course of her life. Now, Churg Strauss syndrome is an uncommon illness. It belongs to a family of diseases that are characterized by blood vessel inflammation or vasculitis. And really, by anyone's definition, this is even uncommon in the vasculitis family. It's estimated to affect about 3 people per million. And when we talk to our trainees, our medical students and fellows about Churg Strauss syndrome, there are several aspects we get them to try and think about in trying to recognize this illness when they come across patients during their care. There are really 3 facets that are often used to identify Churg Strauss syndrome. There are allergic features in which we can see features involving sinus symptoms, and asthma, particularly occurring in adulthood or worsening in adulthood, is quite common. Now, a second facet refers to a cell called the eosinophil, which is a normal type of white blood cell which we can see in allergies and in inflammatory conditions that can be increased in people with Churg Strauss. And we can see this in the blood and sometimes in the fluid and tissues as well. And then the third feature, which really defines this as a member of the vasculitis family, is the vasculitis itself. And this can occur in multiple different locations, most particularly incurving the nerve, the skin, the kidney, the lung, and potentially even the heart. And all of these are what make a difference in terms of how we make this diagnosis and how we approach this therapeutically. Now, as you can imagine, this is a challenging diagnosis to make, even at the best of times. And again, even though we instruct our trainees as far as the features to watch out for, one of the things we recognize is that not all people and not all patients will have these features, and they may not always occur in sequence. And this is what can make Churg Strauss syndrome a challenging illness to make the diagnosis for. How these features come together also has an influence in terms of the types of treatments that we choose. And this can range from the foundation, which is our friend prednisone in the glucocorticoid family. And then we also use other medications potentially, such as methotrexate, azathioprine, also called Imuran. And when the illness becomes severe, sometimes we use the medication called cyclophosphamide or Cytoxan. And all this is based upon trying to judge where the risks and benefits lie for that individual person. So let's talk to Ms. Corwin and think a little bit about how Churg Strauss syndrome has affected her and how this came to be during the course of her life. And really, as I recall, when we met each other, you had begun to have some symptoms around 2005 as far as some unexplained cough.
Yes.
And then during around 2007, there was the diagnosis of asthma during the course of your life. And then during 2008, some features continued to develop, including with the sinus, and then you had an unusual rash.
Yes, I did.
And where was that located for you, and what was that like?
It started with a pink spot on my navel, and then it became purple. It spread to my trunk and my legs. It looked like purple fluid-filled lumps on top of lumps. It was very unattractive, and it was all over my trunk and my legs. My dermatologist, my internist, they had no idea what it was. It was biopsied by the dermatologist who found high eosinophils.
Right, and that biopsy was in fact an important piece of the information in trying to put this together, as far as they had seen the eosinophils in the blood. They saw this in the tissue. And there are also some hints as far as vasculitis they also saw in the biopsy as well that started to put some of the things together. And then your doctor had also done some chest imaging, and that revealed some changes in the lung.
And I had a bronchoscopy.
Yes.
With biopsies, more eosinophils. Plus they said I had eosinophilic pneumonia. I had a lot of things, but they weren't putting it together in a package for a diagnosis. I was just sick.
So how did it ultimately end in getting put together?
Between all the information they had, I was in the hospital 4 times. I had many specialists come in. I had a bone marrow biopsy. I had lots and lots of things done to me, and a lot of doctors talking about me, infectious disease, all kinds of things. They finally were able to put together this whole package. Plus, I was getting sicker and feeling sicker, and I felt like I was dying inside, like you know your own body. I knew something was terribly wrong inside my body, and I was slowly getting sicker. They put the package together, and one day they said, aha, Churg Strauss syndrome. Then I got on a program, I got to you, and things have been better since.
So what was it like as far as, again, I imagine, again, it was very frustrating not having a name to put to this, and then a name arrives, and it's a name most likely you and your family and friends have never heard of, Churg Strauss Vasculitis, and what was that like?
It was very frustrating, but of course it was good to have a name to it, and there was a new set of things. Well, what is this disease? I knew nothing about it. I didn't know where to find out about it. One of the doctors referred me to the Arthritis Foundation. I called them and they said, no, we're not the right people. But I believe they were the ones who got me onto the Vasculitis Foundation, where I called them and I said, I don't know anything, can I get some help? So immediately they sent me information and I started to learn more about the illness and what it was all about. But my internist that I had for years, he couldn't help me because he didn't know anything about it. Most doctors don't know much about it. So I was very much helped by the clinic and all the specialists I saw at the clinic, and I educated myself. And knowledge is power. I was still sick with the disease, but I understood it better, and that made me feel better about it.
Absolutely. So, and as you mentioned, you got started on a medication program, which included the prednisone and also the methotrexate.
Yes.
And again, during that initial period, improvements on one hand as far as how you were feeling, and at the same time, some challenges as far as with the medications. And how did you face some of those?
Well, prednisone, I was warned what the terrible things prednisone would do and the side effects, and they're basically true. I just dealt with them. I said, this is what I have to deal with. There are worse things. This is not cancer. And I'm going to have to deal with the side effects that I need to deal with in order to get well. So I did, and I do. And I'm just grateful that there are medications that can help me get along and live a fairly normal life.
So in 2009, the prednisone was coming down, and at that point you started to have some return of your asthma symptoms, and this is indeed not an uncommon thing that we can see in Churg Strauss, is that there can be a recurrence of symptoms. In some instances this can be the vasculitis, but on other times it's very frequent that the asthma or the sinus symptoms may return. And what was that like for you when you started to have some of the return of the symptoms?
I thought, I don't believe this. I'm on prednisone and I was doing so well, and now I'm wheezing and I can barely breathe. It was scary. It was scary, and I knew that I'd probably have to start the prednisone back up again, which is not fun because it takes forever to bring it back down. But I called you and you had me come, because we don't know if it's just a kind of a cold or a little bit of flu, or is it vasculitis, so one has to call one's doctor. I learned that from you. So I called and you insisted I come right in, did a CT scan and jacked up the prednisone, and of course then I started to feel better.
Yeah. And I think Ms. Corwin brings up an excellent point, and that's one of the things that is so important as far as to this relationship and to the evaluation of Churg Strauss, is to maintain open communication with the doctor when there are symptoms that come. We have to, again, not make an automatic assumption that it is part of the illness, but look for the possibility of medication side effects or infections. As you mentioned, we do thorough evaluations as far as looking for all of the things that can accompany vasculitis. And again, once we get that information, we're more well embarked as far as what we need to do at that point, in which, again, as you mentioned, for you, the best choice was to increase the prednisone. Unfortunately, we didn't need to make a change in the other baseline medication. Now, around 2010, you had another challenge as far as where you started having some neck problems and ultimately had to face a very difficult neck surgery. And though, again, this was maybe had certain links with Churg Strauss, it was not a direct manifestation of Churg Strauss. And again, telling us that even people with vasculitis continue to face other health problems as we can all face in life. And what was that like as far as for you, as far as, again, someone with Churg Strauss having another medical problem that had introduced any concerns as far as how is my surgery going to go? What was that going to mean to my doctors?
Oh, yes. Well, it was very disconcerting because I had terrible pain in my left arm and my left hand for months. And we tried everything, you know, the chiropractor and physical therapy, and I had 3 pain blocks. We tried everything. MRI said I had a pinched nerve. Well, does it have to do with Churg Strauss? Or, you know, normal people get pinched nerves too. Mm-hmm. So it finally came down to it that they decided it didn't have anything to do with Churg Strauss. It was a pinched nerve in my neck that was causing the arm pain. So they prescribed surgery for it. And of course, I called you from the surgeon's office. I said, is this okay? Because I don't make a move without you. And you said, okay. And I had the surgery. I'm fine now, a year later, 2 years later, really. But it was a long recovery because when you're on prednisone, you heal slowly. So it was a pretty bad recovery, and I wasn't prepared for how bad it was going to be. Had I been prepared, it wouldn't have been so bad. But I'm fine now. Wonderful. Cured.
And that really does bring us then to current day as far as, again, you're on some prednisone and methotrexate. You know, you're having some ongoing things that you're continuing to work with. And how do you feel things are going today for you where you're at?
In the vast configuration of things, I think things are going very well. I have a very serious, incurable disease that is rare and not well known, and yet I'm doing pretty well. I get in my car and go where I want to go and do what I want to do. I have some limitations, but I think everybody does in different ways. But I feel I'm doing pretty well. I see a lot of doctors. I take a lot of medicines. I get my blood drawn at least once a month. I'm busy with that, taking care of myself, making sure I don't get overtired, napping during the day. But I think I'm doing very well because I don't view my disease as I'm one big Churg Strauss person. You know, I'm a regular person, and I have an illness that I have to take care of and incorporate into my life. So I feel I'm doing okay, in spite of the problems that I do have that are ongoing. I feel I'm doing pretty much all right. Mm-hmm.
So what has the diagnosis of Churg Strauss meant to you in your overall life? What ways have it brought challenges, and what ways has it brought also strengths?
Well, certainly it's brought challenges. It changed my looks. I used to be thin and lovely, and prednisone does some weird things to your body, which I've learned to accept since I don't have any other choice, so I'm not going to waste any time over that. And all the medication and the expense that's involved with all these doctors and all these visits and this and that. So I do that, but it's really given me more than it's taken from me. I have met the most extraordinary people connected with this illness, my doctors and the Vasculitis Foundation, and the wonderful patients I've met all over the world, many of whom I'm able to help by talking to them, by letting them know there is light at the end of the tunnel. It's not so bad. There's worse things. I kind of can help people keep the disease in perspective as opposed to letting it take over their life. So it's made me feel very good about myself. I had to go on disability when I got sick because I couldn't work a full day anymore, but I'm able to help. I'm still able to go out in the world and do some good and really make a difference to people. So that was a very good thing that happened because of this disease.
And you've been very engaged with the Vasculitis Foundation and with vasculitis education in general. And what are some of the things that you've done as far as outreach?
Well, I run the Vasculitis Foundation support group chapter in the Cleveland-Akron area, which started from nothing. And I started the group, and we have a very nice group. We have between 20 and 30 people right now, and it's a very nice group. And I teach those people how to reach out and raise awareness. I talk about awareness all the time. I'm forever teaching doctors, medical professionals, anybody I run into on the street, teaching them what vasculitis is, what they can do about it, what they should know about it. I go to emergency rooms. None of the personnel know anything about it. I say, oh, let me teach you what I have. So I'm busy doing that all over the place. And I think that's very important, that we get this disease out in the public where it's a household word. I'm working on it.
Oh, that's wonderful. Mm-hmm. And this is really what we're all about here today, as far as really raising awareness and knowledge about Churg Strauss syndrome and about vasculitis. And as you mentioned earlier, knowledge really is power. And I think that's certainly very much what we're hoping to try and bring to people, and what the Vasculitis Foundation brings to people as well, through their support of education, support of family, and support of research. So I'd like to thank Ms. Corwin for being with us here today. I'd like to thank all of you who are joining us for this video, and to thank the Vasculitis Foundation for everything that they do in support of our patients and our work. Thank you very much.